In the past, puberty began between 10 and 14 years of age. Today, girls are beginning puberty earlier than ever before. The proportion of girls who experience the physical changes of puberty, such as breast and pubic hair development, starts at ages 7 and 8, and it is greater today than it was reported on girls born 10 to 30 years ago. By 8 years old, there are differences that vary by race. 43% of black, 31% of Hispanic, and 18% of white girls have breast development that indicates puberty at the early age. We also find that genetic mutations, stress, home environment, and insecure maternal attachments in early childhood can also contribute to early puberty in girls. Of course, we understand this is nothing more than a hormonal response to not only the genes, the genotype, the genetic makeup, but also the environment. Please note that, again, puberty can be experienced as early as 7 years of age in modern times, and this would, early menstruation onset would be related to overweight. We find that the more overweight girls are, the more likely they are to start their period earlier. This initially was thought to be just coincidence, but through correlational findings, we've also seen that girls who have some type of eating disorder, specifically anorexia, one of the symptoms they experience is the amenorrhea, which is the lack of a period thereafter. So we see that that occurs with individuals who are significantly underweight, therefore leading us to confirm our suspicion that body weight, and fat portions in our body is related with the menstruation onset. The puberty basically begins when the pituitary gland that lies underneath the hypothalamus in our brain indicates that there is already maturity that's been reached. And when it detects that, then it starts releasing two primary hormones that are called follicle stimulating hormone, that's FSH, and then luteal hormone or luteinizing hormone, that's LH. This basically increases the ovaries' production of estrogen. And what estrogen does is that it increases the size of the fallopian tubes, the uterus, the vaginal walls, the breast, buttocks, and thighs, and that gives way to, again, to the sexual maturation process. When we look at the female puberty, we continue looking at how every single function, every single change that occurs at the body is designed for reproduction. When the pelvis begins to widen, again, it allows for the easier carrying of a child should pregnancy occur. The pubic hair begins to grow, and that also, although it is a trend now to not have much hair, it is supposed to help in maintaining the area a little bit more protected, just like, again, nostril hair that may not necessarily be pleasant, but it serves a purpose. And we start seeing that ovulation begins at this point. Now, ovulation is basically the time at which women start being fertile. And this is usually around the age of 11 or 12 years of age. There are some women that experience pain with ovulation. It's not that common, but it's called Mittelschmerz, and that is experienced, again, by very, very few women. The majority of women do not know when they started ovulating because, again, they do not have any discomfort or symptoms. Menarche is typically the most common form of women knowing that they are already fertile, but it is not necessarily aligned with fertility. You see, oftentimes people think that the moment a girl starts her period, she may be then able to have children, but studies show that there are girls who actually get pregnant before they even got their first period, leading us to believe that ovulation can occur before. There are also some girls who may have gotten their period, but they may not be ovulating yet. We also have found through different studies where they evaluate voice changes in women throughout the menstrual cycle, and they've found that a woman's voice is rated by men as significantly more attractive when she's ovulating than when she is not. And so we perceive this to be a subconscious sign of her fitness and fertility And that's why we see that this is, again, a very interactive and very complex process in the woman's body. Here's yet another evidence, a form of evidence to see how the menarche can have an effect not only on the woman, but also be tied to her children here, and how this may be a byproduct of our genetic makeup, our genotype, and or the environment. Here is a graph that shows the mother's age at menarche in years, and also the percentage of children that would be obese at the age of 9. So we find that the earlier age of the menarche in biological mothers is related to increased risk of obesity in their children, even more so in boys than girls. So again, looking at the age in here, you would find that there is girls who start at the age of 11 more likely to give birth and have children that would be obese, not overweight, but obese. That's above the 30% using the body mass index. Overweight would be like 25 to 29.9. And then the older the girl is when she gets her period, the less likely their children are to be obese. The average menstrual cycle is 28 days, but it does vary from woman to woman. There are some women that actually go through shorter cycles, some go 30 days, and this can all be affected, again, by genes and by the environment. There are some women that may delay their period because of a stressful moment or various other activities that we'll talk about a little bit more in detail later. But please note that menstruation is defined as when the uterine lining is shed whenever the woman is not pregnant. The tissue and the blood, which is what we call the menses, are released. And so the menstrual cycle that lasts between, again, on average 28 days, but it could be from 24 to 35, is made up of 4 phases. The follicular phase, the ovulation phase, the luteal phase, and the menstrual phase. Here you can see how throughout these days in here, how the hormones fluctuate. You see in this is day 0, so right after a woman finishes her period, there begins to be a buildup of what eventually will become the menses, and it's going to get rid of this in here if there's no pregnancy. This is what we would call the endometrial layer. You can also see how the hormones change. There's low levels of LH, luteinizing hormone, low levels of estrogen, and then eventually start going down on FSH that starts increasing in here. Here, on average, the majority of women ovulate on the 14th day. That is when they are fertile, but not every single woman does. So it's not to be used as a form of birth control with them in here. We also see how the ovary basically is developing the follicle that eventually will become the egg. So here you see that in day 1, it starts developing, and then it starts ripening, it starts maturing. Right here, at the 14th day, it's when ovulation takes place, and that's when it ripens, and it now is traveling through the fallopian tube for a day and a half or so. Then after that, again, early corpus luteum, and then regressive corpus luteum if there is no pregnancy in here. The endometrial thickness, that's again the menses, that's what's going to be released. In the menstrual phase, that is basically when you are shedding the tissue and the blood. And then right after that, then you start the process of rebuilding. If there is no pregnancy, then you go back to this in here, and the cramps come in, and you start shedding this in here, and you go back to nothing. But if there is a pregnancy, then this has to stay elevated because that's what the organism will bind to. That's why when women sometimes have, they spot or they have a little bit of bleeding, they have to go see the doctor right away because it could be a miscarriage, as this allows for the organism to bind to the uterine wall and survive. Menstruation goes through these 4 phases that were just mentioned in here, and it does so by basically fluctuating the set of hormones that is responsible for controlling the production of another, and eventually again make a woman fertile if that is what the body allows. But the negative feedback loop basically is how one set of hormones that controls the production of another will in turn control the first, and it just continues feeding off of this in here. We find that the increased level of oxygen and progesterone will signal the hypothalamus to decrease the gonadotropin releasing hormone, which is what we find GnRH. And so when this then decreases GnRH, this will bring about a decrease in FSH and LH, which is follicle stimulating hormone and luteinizing hormone. This will then prompt the ovaries to decrease estrogen and progesterone, which will then prompt the hypothalamus to increase GnRH, which had just been decreased here. This increase in GnRH will then prompt the ovaries to increase estrogen and progesterone, which will then prompt the hypothalamus to decrease GnRH, and this continues throughout the 28 days. This is basically the beautiful interaction that exists between the hypothalamus and the endocrine system via the pituitary gland. I'm sure if you're a woman or if you have a sister or a mom or a girlfriend, wife, you know that not every single month is the same. There are variations in the menstruation across women, but even within the same woman, you were able to see several other variations that were amenorrhea, which is the absence of menstruation, either primary or secondary. Please read up on that. Very self-explanatory. Dysmenorrhea, which is painful menstruation. DUB, the dysfunctional uterine bleeding, and menorrhagia, which is basically excessive menses. But I'd like us to pay a little bit of attention to the PMS and the PMDD because there are some controversies with these diagnoses. PMS, basically premenstrual syndrome, is often used for a lot of jokes and light fashion, even among women. But we find that this is actually a disturbance that could bring about physical, behavioral, and emotional symptoms that occur typically the last few weeks of the menstrual cycle. This has gotten a lot of notoriety as it has been used in the court system to reduce sentences of women who had either killed their husbands on the grounds of severe PMS or had committed some type of crime in here. So in the 1980s, PMS became well known in the court system. PMDD is a more modern diagnosis in here, and this was introduced in APA in 1994 to identify the most debilitating cases of PMS. But it made its debut in the DSM-5, which is currently what we're using to diagnose people as criteria. Now, the criteria has four groups that we need to base it off of. Your mood needs to be significantly impacted. There needs to be behavioral changes. Somatic, like your body, you have to have those symptoms, cramps and intense discomfort. And also the cognitive symptoms. That is to say that your ability to reason, your ability to think clearly may have actually been compromised because of this in here. So as a result of this in here, and because they do identify this to be a debilitating condition, they've begun to prescribe SSRIs, which are forms of antidepressants. They also recommend that there be lifestyle changes so that there could be some relief there. Now, there are differences that exist. Black women seem to experience more food cravings during the premenstrual week than white women do. This is per a study that was first done in 1980s, and it's been replicated several times since, having equal findings. White women report premenstrual mood changes and weight gain more so than black women. And Hispanic women report more severe symptoms associated with premenstrual times, whereas Asian women would report less. And so there's a lot that still needs to be investigated, and keep in mind that these are just correlational findings based on a sample. At the time, it'd be interesting to be able to replicate these time and time again so that we could see if there have been any changes with consumption of maybe more hormones in our food today or more soy products to see if anything has changed at all. Please note that these risk factors for suffering from PMS and PMDD are based on correlational designs. We've not experimented with women by exposing them to these terrible conditions. We've simply asked women about their habits, and based on that diagnosis, we started asking about their history of depression in the family, if they've been victims of sexual abuse, and through that we try to understand whether this is more of an environmental factor or if it's something that was genetically predisposed. Please note that the majority of women that are treated for PMDD or PMS respond well to the antidepressants, but they do have some side effects, and the most common one are headache and sexual dysfunction. Specifically with sexual dysfunctions, they often report the inability to reach orgasm, low libido, and the inability to then get pregnant also increases. As hated as the menstrual cycle is by some women, because of the discomfort of the cramps and the inconvenience that it could bring about, uh, there are women that actually choose to have their period more so than suspending it or suppressing it. And in average lifetime, women can experience up to 450 periods, and that is again from the time they start in puberty until menopause. There are various ways on how we could stem the growth of the endometrium, which can reduce the cramps and the flow, whether it's heavy or light. And also we could even stop the period in what is claimed to be a healthy way. Birth control, typically there's a 21-7 cycle, which is to say that you take hormones for 21 days and then for 7 days you suspend it. But there are also continuous birth control pills that don't suspend it, or if they do, they suspend it after a more consecutive chain. So seasonal and seasonique are two forms of birth control pills that provide 84 consecutive days of hormones, and then they go through a placebo, which there is no hormones at all, just sugar pills. And if they take this, women who take this can actually reduce their periods from 12 to 4 periods per year. Librel is another one that actually does continuous exposure to hormones for 365 days, no placebo at all, and this stops the menstruating altogether. Again, regardless of how hated the period may be, the majority of women actually prefer to have their period, as they see it as a sign of health and also as an indication of whether they're pregnant or not. Additionally, please note that some of these birth control pills and treatments like IUDs and injections have been also used to relieve a lot of symptoms that are related to menstruation. So again, heavy blood flow, severe cramps, and other conditions can be alleviated and relieved by birth control. However, there are various symptoms, and they do vary from person to person, and sometimes women do not want to do this in here because the body basically is tricked into thinking that you're pregnant, and so a lot of the symptoms like morning sickness, breast tenderness, back pain, and sometimes depression, it could last for 2 to 3 months before the woman gets adjusted to the birth control here. Menopause is the time when women reach the beginning of the end of their fertile years. The menopause is basically a woman's final menstrual period, and climacteric is basically a period of decreased estrogen production and menstruation. You may remember that puberty started with increase in estrogen production that basically gave way to the widening of the pelvis and the uterus and the vaginal walls. That, along with progesterone, gave way to the development of a woman's body who was able to reproduce. Well, in menopause, there is now a decreased amount of estrogen, and this begins by slowly stopping the menstruation. And it's not something that occurs abruptly. It is a gradual process. The average age at which women go through menopause is 51 years of age, but we have seen it occur earlier and earlier, just like we've also seen women start their period earlier. So from as early as 40, sometimes even in their early 30s, women are experiencing menopause. And some of them would go into menopause as late as the late 50s. This typically starts off with more regular cycles. Women start sometimes bleeding less. They may not ovulate even though they may get their period, they may not ovulate 1 or 2 months. The sexual glands little by little begin to decrease in size, and so you start seeing the clitoris, the ovaries, the uterus, labia, all these things begin to shrink. And the secondary sexual characteristics also begin to change, such as growth of hair on the upper lip and chin, the drooping of the breast, wrinkling of the skin, osteoporosis, and the shrinking of the vaginal wall also occur. Because of the shrinking of the vaginal wall, you also have you're less likely to get lubricated and get aroused for sex as you were when you were younger. The reason why there is growth of hair on the upper lip is now because the estrogen, which for so long offset the presence of testosterone, androgen, which is found in women, is no longer there. So when estrogen has dropped significantly, androgen remains at the levels where it used to be, and over time it may bring about, again, some secondary sexual characteristics that appear in a woman. The hormonal changes bring about discomfort, hot flashes, headaches, sleep disturbances, and oftentimes the mood that is often reported by people is a result of the sleep deprivation. If you don't sleep well during the night, you can't be emotionally and cognitively well throughout the day. So women often report a lot of discomfort, hot flashes, headaches because of this in here. We also find that there are sexual complaints, which again, low sex drive, vaginal dryness, and lack of tenderness and sexual contact with the partner. Overall, the menopause is a byproduct of a natural change that occurs, but it can also be induced if the ovaries were to be removed. And the reason why is because the ovaries are the ones that produce estrogen. Not that long ago, in the 90s and even into the early 2000s, hormone replacement therapy was almost a standard treatment where women who went through menopause would be prescribed by a doctor some hormones so that the symptoms could be reduced. However, there are a lot of health risks associated with it. There's an increased risk of breast cancer, and because of that correlation, they no longer do so. There are new therapies that are offered now with lower levels of hormones that may be used, but they often encourage the woman to seek some natural ways to cope with the symptoms of this hormonal imbalance. And so here you see several soy products, ginseng, and various others. But please note that these, although they have some benefits, they are not to be just taken lightly. You should consult with a medical professional before starting this in here. Soy products, the reason why they would reduce that is because they mimic estrogen. And so if you're no longer producing estrogen at that same rate, and you are able to gradually wean yourself off of these dropped levels of that by consuming some products, this would help, again, relieve some of the symptoms.